Hi, my name is Andrea Klein-Tilford. I'm a pediatric nurse practitioner, the immediate past president of the National Association of Pediatric Nurse Practitioners, and nurse practitioner director at the University of Michigan Health System. Welcome to this RSV Microlearning session. Did you know that RSV is incredibly common? It is widely circulating in our communities. And not only is it common, but it is also incredibly contagious. And it is very hardy. It lives on surfaces for hours. Nearly all children are infected with RSV at least once by the time they are 2 years old. For most infants and children, RSV will result in a mild illness similar to a common cold. However, in some children, it can lead to serious illness and, in rare cases, death. Infants are at higher risk for severe illness than older children, and there's a couple of reasons for this. They do not have primary immunity from the illness since they have not been infected previously, and anatomically, they are much different. Their nasal passages and airway are physically smaller than older and larger children. In fact, infants less than 6 months of age rely on breathing through their nose, which is really challenging since RSV results in so many secretions, making it difficult for them to breathe. While age alone, particularly less than 6 months, can place an infant at higher risk for hospitalization and serious disease, there are other risk factors for serious illness. Among them include a history of prematurity, underlying neurologic or cardiac disorders, and weakened immune systems. Sometimes, infants and children without any underlying medical conditions can get seriously ill with RSV. Some infants and children develop more severe illness, especially when the virus spreads to the lower airways, resulting in either bronchiolitis, which is an inflammation of the lower airways, or pneumonia, an infection in the lung. Hospitalization due to RSV in infants is not uncommon. In fact, 1 to 2 infants out of 100 that are less than 6 months of age and infected with RSV will require hospitalization. Sometimes the illness may seem mild for the first couple of days and then progress over the next several days to become a more severe illness. Even once hospitalized, the infant can get sicker before getting better. There is not a specific therapy or a cure for RSV. Treatment relies on supporting the infant or child for the duration of the illness. Typically, this includes supporting breathing, clearing secretions, and maintaining hydration and nutrition. The supportive therapies can look different for each infant and child due to the severity of illness. To help keep children safe from reinfection with RSV, there's a few easy tips. Frequent hand washing is essential. Staying away from large crowds, avoiding contact with others known to be ill, and covering coughs and sneezes can all reduce the risk of reinfection. I am sure these all sound very familiar by now. Additionally, keeping vaccinations up to date to avoid co-infection with RSV and a vaccine-preventable illness such as influenza or pertussis is critical, since co-infection can result in more serious illness and disease. Thanks for joining.